Welcome, welcome, welcome everyone to Never Alone Live. We are excited today. We have with us from Charleston County, South Carolina, Chief Christopher Rozier. And Krista and Chief met not too long ago, and then we had a conversation with Chief Rozier, and he told us a lot of the programs that they are running in Charleston County. So we're really excited because he's going to tell us about that. Today's topic is we're bridging the gap between addiction and law enforcement. And so Chief, tell us a little bit about you. What got you becoming a police officer and interested in this addiction epidemic?
Yeah, so I actually started my career in emergency services. So I was an EMT for a small county in South Carolina, and I noticed that we were continuing going to the same overdose houses day after day, and eventually we would end up going there for a fatality. And I was very early on in my career, and I said, "There's got to be something better." And I remember being told, you go to the call, you clear the call, you go to the next call, and I was like, "There's got to be some type of follow up." So as time went on, I decided to switch into the law enforcement aspect of it, and I've worked for the Mount Pleasant Police Department for 17 years. And we started at that time, it was Chief Carl Ritchie. We started an overdose program, community wellness unit, and really started developing it. Well, last November, he was elected sheriff of Charleston County. And he offered me a chief deputy position to come over. And part of that position is going to be running the community wellness unit. So I developed my team, and we came over to Charleston County. We started January 7th of 2025. And our biggest focus is recovery in the community, bridging the gap from law enforcement to nonprofits to those that are experiencing overdoses. And what can we do? Let's eliminate the stigma, reduce the stigma as much as possible, and let's work together. There's stigma among law enforcement related to overdoses, as well as those that are having substance use disorder and law enforcement. So we started having roundtable discussions and started really formulating a program using technology. We implemented a program called CIMS, Critical Incident Management System. And what that does is it allows us to share information for overdoses in real time with those that are in recovery to provide peer support. The first year we implemented that in Mount Pleasant, we saw a 40% reduction in non-fatal overdoses. So we knew it was working. So we've expanded it countywide. Recently, Charleston County Sheriff's Office has taken over as the lead for that program for Charleston County. Dorchester County has just implemented that program as well. And our goal is to track every overdose correctly and to provide services in real time for those that need it. One part that we're excited about expanding to is we also have a detention center. Our average detention center population is anywhere between 1,200 and 1,500 per day. Our goal is to reduce that and provide as many of those individuals that are in crisis services. So currently, one of the first things we did is when you go to the detention center, if you have a substance use disorder, mental health, any of those screening, we put evidence-based screening tools in place. Those screening tools will now get you flagged where we can provide you services while you're in the detention center. And when you're released, put you right into services as well. And then follow up. The biggest thing is constant follow up. Now we're taking it a step further, and we're very early stages of looking at what we call the Yellow Line Project. We're working with Charleston Center, which is a county-run recovery facility. And our goal is to prevent the individuals from even getting incarcerated. So pretty much Yellow Line, if you cross this line, then you're going to be booked into the detention center. If you have these certain number of charges and we can provide services to you, we'll hold these charges till you complete programs, and those charges will not even go on your record. So our biggest thing is getting those that really want the help into recovery, and then those that don't want the help, trying to encourage them to get the help. So again, we cannot arrest our way out of this crisis that we're going through. We're definitely going through a crisis when it comes to overdoses and mental health. So we want to think outside the box, get information from those in recovery, and work through it together. And the biggest way of doing that is by talking to those that have been walk the walk and talk the talk. But we've seen some good projects. We do know there's a couple things out there. People fear law enforcement, and totally transparent. Do we go after the drug dealers and make arrests? We do, 100%. But those that are having these low level offenses and that's really trying to make a difference, we want to take that step beyond and not make charges. One thing we do not do, if there's an overdose, we do not make a charge on that. We want you to call the police. We want you to call the sheriff's office. We want you to call EMS. We want to save lives. And then one thing that we have done, so last year, the sheriff's office, before we took over, gave out about 101 Narcan kits to the public. This year, we're already approaching 1,800, so a big difference. And we're working with Charleston Center with these purple boxes, like a mailbox, all throughout the county. We rotate them based on spike alerts where we're seeing overdoses, and we're providing free Narcan to the public. The first thing you see when we post about that is, why isn't there insulin, right?
Yeah.
Why aren't there other services that are being provided? We took a lot of backlash on that, which our first post went viral, which was fine. You know, our biggest thing is, this is opioid settlement funds. It's not tax dollars. It's from Big Pharma. And we're able to use those funds to provide services. And our biggest thing is follow up. You know, you can't follow up with someone in a week and then forget about them. You have to constantly follow up. So that SIMS programs allows us to track those overdoses. We've expanded our services. We have one mental health clinician in the jail that works directly for the sheriff's office. We're getting ready to add a second. We have 2 full-time reentry specialists that help you get back into society. Driver's licenses, birth certificates, anything you need, helping you find jobs. We've used the opioid settlement funds for a recovery scholarship. So we're paying to put you into recovery. Last week, we took someone to CVS and got them their prescription. And then we're doing the follow-up every week to make sure they're maintaining where they need to be. Yeah. And then we have 1 opioid outreach specialist in the detention center. And we just got funded through the funds again through opioid settlement funds to add a second to patrol. So they'll start going out to these calls and doing some follow-up. So I know it's a lot of information.
Yeah,
that's what we're doing.
Chris, this is amazing, and I love what you're doing. And you just kind of gave a lot of information. I kind of want to break down some of the stuff that you're talking about. I mean, the biggest thing, Charleston County has 500,000 people in it. And the fact that you're able to decrease overdose numbers by 40% using technology, this is miraculous. Everyone in every government in the country should be using this. So you call this is the critical incident management system, right? Let's talk a little bit more about this, because we've got a lot of people in recovery. You see all the comments in here, but we've got a lot of people in recovery. But we want to bring this. And we want our friends to be able to bring this interview to their states so they can actually digest. Oh my goodness, here's Chris that's talking about this system. How do we implement it? So let's talk a little bit about this, and then I want to get into a couple other your programs a little bit more in detail. But let's start with this. How does this technology work between you and the addict suffering and the actual decrease of overdoses?
Yeah, so here's what happened. And sorry, I'm making some notes as I see some of the comments so I can get back to some of these good questions that are popping up. But one thing that I wanted to mention is, so when there's an overdose that occurs, we get a notification about it. We have real-time notification. It comes to one of our lieutenants, and as well as me in the group, and we see that there's been an overdose at 123 First Street, and this individual was involved, and these other parties were on scene, right? So those other parties on scene are at risk. They're very at risk of having an overdose because they're there when someone else is overdosed. So we focus not only on the person that's had the overdose, but everybody inside that house or that friends group. And we start providing services, no matter what it could be. And that's, I think, is the biggest thing, is we're focusing on the at-risk individuals. Yeah. So we make an entry into a computer database. We have a trusted partnership with some nonprofits. We have memorandums of agreements in place along with funding. And we send them a notification, and they get a notification. We've had an overdose at 123 First Street, and these are the parties involved. They pick up the phone and reach out and try to make contact, offer services. They don't get a phone call. They try it again. They keep trying until they get someone, and then they also can go out to the house and do a visit. Wow. Now, again, our opioid outreach specialists are civilian employees, but they work for the sheriff's office, right? So the first thing those that are in substance use are going to say is, there's a cop at the door. It's got to be a narc, right? We make sure people understand that's not the case. We're not there looking for paraphernalia. We're not there looking for charges. We're there to get you into services, right? Like, that's our biggest thing. Now, so things that are important. Our narcotics division, they work the investigation to determine who they try their best to find out who the dealers are and go after them. Last year there was a very big bust in North Charleston, one of the hotels. Ever since that, we've seen a drop in overdoses in that area. So obviously they were killing people, and they should go to jail for that. However, those that are having the issues in the substance use disorder, we're providing those services and getting them into treatment. So once we reach out and get them in and get some services, we continue to follow up. The system has a tracking system. So every few days, whatever we set it to, 5 days, 6 days, it alerts us that we need to do a follow-up. We just reach out, hey, Susie, how you doing? You still in treatment? You need anything? So that's part of it. It is not an investigative tool. It's absolutely not allowed by any of our detectives. It's very strict access. And again, the biggest thing is tracking those that are experiencing substance use disorder and providing real-time follow-up for help.
That is amazing. That is amazing. And so, addiction and alcoholism, all these things, this is a disease, so, I've been sober for 21 years. I've gotten sober through Alcoholics Anonymous, and I work the steps. And my book tells me it's a disease. It's a progressive disease. That first time you drink, that's not the end all be all that's going to destroy your life. It's that later in life, as we go, and our mind gets kind of flooded. And now with all these other drugs that are out there that are really heavy hitting, the fact that you guys are looking at it more like a disease than an infraction, it's amazing, brother. And that's why I'm really excited for with this conversation. The Yellow Line program that you're doing, I want to kind of dive into that, because that's just something that could be implemented very easily in other police departments, correct?
Correct. And I just want to make 2 comments before I forget. One, I've noticed a lot of people are posting about their county needs this. We have met with the Sheriff's Association in South Carolina. So all the sheriffs, we've got in front of them and talked. Also, we're presenting at the South Carolina Governor's Conference. Our biggest thing is we want to get as many counties involved as possible. So one thing that's nice about this SIMS program, you may live in Boston, but travel to Charleston, have an overdose, and we've had this happen. That notification, because they're part of the system, if they're part of it, can alert back to Boston. So not only do we provide you initial services, Boston can follow up with you and make sure that you're getting the long-term services. So it crosses over county lines. So now that Dorchester County is involved, Dorchester, Charleston, and Berkeley all touch. And, your neighbor may be in one county and the other neighbor's in another. Like it's just the way it works. We're able to share this information across jurisdictional lines. And if anybody is good about hiding information, and I shouldn't say hiding, but not sharing information, is going to be law enforcement. Right. So we've got to be more transparent and share it. And we can't just say it. We got to do it. And that's a big thing with our agency. We don't just say the words, we're putting the actions. And these numbers back that up. Now, the Yellow Line project, it's very new to us. We're just now developing it. Dr. Fonsell from Charleston Center is really kicking this off and working with it. And we're going to learn. It was trial and error. And, just like with SIMS, we got doors shut in our face, just like, those in substance use disorder. They've had doors shut in their face. So did us as law enforcement. We had to fight to get this program and fight to get information sharing because no one wanted to share it. But now they see the value of it. One of the best things is I was at a memorial service last year and a lady walked up to me and gave me a hug. We've been working together. She's with a nonprofit. And she's like, you know what? Last year, an officer was tasing me and locking me up. This year, I'm giving you a hug and you're helping me. And I've been in recovery. And that to me is what it was about, and every time I see her, we run up to each other and hug each other. And they're like, how do you know her? I'm like, well, she's in recovery. We're helping each other out. She's kind of my mentor of what we can and cannot. What are we doing right? What are we not doing right? If something we're doing is not working, she's willing to come forward and say, hey, this is dumb. You need to fix it. So we listen. And then she's like, you keep checking on me, even though you don't have to, just saying, hey, how things going? So I think that's the biggest thing is we have to understand we're all in this together. It doesn't matter if we have a badge and gun, right? We're in this together and we have to help each other. If you don't think law enforcement officers go through these exact same things, you're wrong. We do. We have EAP programs in place to help those individuals that may be having an issue. But you first have to acknowledge there's a problem, right? Like you said, it's a disease. We have to acknowledge it. And then we got to provide services. And what's not working, we have to change. You can't just keep doing the same thing that's not working. If your numbers are going up, you're not doing something right. And that's one thing I like about working at the sheriff's office. We cover the whole county. It doesn't matter if you live in Charleston, Mount Pleasant, North Charleston, we're here and you're in Charleston County and we're going to provide you these services. With the Yellow Line project at the detention center, we're going to focus on 2 parts. One, Before you're incarcerated, we're going to try to work on diversion. Now, something that we've done is we're lucky. Charleston Center has a sobering center. So last week, we took 3 individuals to the sobering center, no charges, just dropped them off, said, hey, they're public intox. They need to sober up. There's nurses and staff there. They'll watch them. And it's really, really, it was a record for them. We've never had 3 dropped off in a weekend. They were all, it was a smooth process. It saves the deputies a lot of paperwork. And then we follow back up. Hey, is this person getting any help? Everything all right? We started piloting a program in Mount Pleasant before we left. We started looking at those that were arrested for DUI and to kind of see where that's at. And we noticed that a lot of the individuals that were having DUIs, their next step was to go to drugs. And they weren't sure what those drugs were going to be, but they were just going to try something, right? So we caught those at-risk individuals before they went into the drug use by catching them with alcohol. So, that's a good program. I see one of the questions is asking about how are we doing that with mental health. So we have what we call a community wellness group, community wellness unit. They cover mental health, substance use disorder. They're kind of commingling. Unfortunately, sometimes someone may have a substance use disorder and also be suffering from mental health. We're working with the Department of Mental Health to provide services. We do a lot with Charleston Center, Favor Low Country in South Carolina, and Wake Up Carolina. We have really worked hard together, and we're trusted partnerships. They have to trust us as much as we trust them because we're sharing some very intimate information about individuals. But we do have memorandums of agreements in place, and there's a confidentiality notice. This isn't to say so-and-so's down the street because they have a substance use disorder. The whole point of it is to provide those services.
This is amazing, Chris. You know what I'm hearing here more than anything is the big difference between you and other people that I've talked to, because I've talked to quite a few people in the law enforcement about this, and it's your open-mindedness. The fact that you're seeing, hey, what we did forever doesn't really work. You have to actually have some sort of solution, and the solution that you're providing. I mean, I love this yellow line idea, and I know I'm beating it up probably, but the idea that, you get a choice, okay, you're here for possession and you're here for public intox. You have a choice. Do you want to be arrested or do you want to go to treatment? And if you go to treatment, you do the program, you don't get those charges. This is amazing. This is amazing. That's the most open-minded, profound thing that I've heard in forever. This is so great. I'm excited. Sorry.
And again, it's not just us. That's us working with the prosecutors. That's us working with the detention center. We all have to work together. And when we have these meetings, we're very fortunate. Scarlett Wilson is our solicitor. She's there. She's at these meetings. She's giving us feedback on what we can do. The public defender's office is there. Some of our judges are there. Like, we're working together as one big organization. And Charleston County has what they call the CJCC, the Criminal Justice Council. Our biggest program is trying to get people out of the detention center and make sure they stay out of the detention center. We don't want to put people in the jail. We want to provide them with services and see them later on in life being successful. That's what it's all about. And then coming back in as a mentor and as a peer support. One of our biggest issues in the detention center trying to get peer support is our policy was they had to be 10 years out of recovery or in recovery. That's a tough time for some people. So we've got that to around 5 years. It's case by case. We do interviews with them, and we contract with them to get them into the detention center to provide services. One of the issues we ran into, in our detention center, not even the correctional officers are allowed to have cell phones. We had to get a special waiver from the jail administrator to be able to use laptops and cell phones for Zoom for a lot of the services that they needed. It's hard to schedule these. So we're able to really work together, and they're expanding their team. The reentry specialist, the mental health clinician, and the opioid outreach specialist in the detention center is one team, and they work together. All right. I'm here with Johnny, and Johnny's got mental health issues, and Johnny's also got a substance use disorder.
Yeah, he does.
Yeah, they both work together. You know what I'm saying? All of them work together, and they're coming up with a plan to fix it and or to provide services, and that's really the biggest thing.
So that's the biggest thing of it all is all of these different pieces of the legislature need to talk to one another.
Right.
You guys are talking with the district attorneys. You guys are talking to the judges. You guys are talking to, and when it comes to all this, I mean, hopefully everybody's seeing that, this isn't just an incarcerate or don't incarcerate. This is people dying. This the heroin epidemic, this fentanyl epidemic, this is really just taking people's lives, and it's taking lives quickly. And so I see where your system, the SIM system, is talking between states. How amazing is that? How do you personally get to, if you hear about a program that you hear is working in another state, how do you go about actually getting that as something you can implement in Charleston County?
You know what, though? Our governments are, well, one thing, I'm fortunate. I work for an elected official. So we have a different set of guidelines, and it's a lot easier. So one of the things that we made easy for us is our community wellness unit. You know how in law enforcement and the military, you have sergeants and lieutenants. It goes all the way up the chain of command. The community wellness unit works directly for me. There's no red tape. There's no sending things through the chain and getting delayed. The community wellness lieutenant works directly for me. I brought him onto my team he came from Mount Pleasant with me. He's best in the business. His background is he was a clinician. Then he became a law enforcement officer. He has 10 years in both, and he's the perfect combination of what we need for Charleston County. So he just gets it done. And that's the biggest thing, is the red tape is what holds things up. I saw a question about people having, what do you do about people that have had multiple tries at sobriety and they keep having relapses? That happens all the time. That SIMS program and the follow-up is what allows us to do it. Now, let's say we're used to seeing Chris on the street, right? And our deputies are familiar with him. They'll pick up the phone and call our lieutenant that's over community well, say, hey, I just saw Chris on the street. He's not looking so good. I know we've had him in recovery before. Can you look and see where the last place was? Oh, he was at Charleston Center. Let me go get him admitted real quick and get him back into recovery. Let's see what we can do. So those are the type of things. The biggest thing is you have to change your culture of the law enforcement agency and have buy-in. And there's no better feeling than driving to work and hearing your deputies on the radio saying, hey, I'm taking this person to Charleston Center instead of the jail. Let's see if they can meet me and get them into treatment. That tells you right there, there's a culture change within the organization. And that's what you have to have. That's the biggest part of it.
So I'm in a neighboring county. I'm like neighbors to Chief. And I got sober 10 years ago, but it was me getting arrested for my 12th time. And I never got a drug charge, but I did have a lot. So when I was seen by my grandma's neighbor, who was the head of the public defender's office at this time. And I had never met him, but it was last resort. He came to visit me, put me in the little where the attorney meets the inmate room. Mm-hmm. And he goes, listen, all your charges look alcohol or drug induced. You're facing 20 years in prison. Why don't you go try rehab? And no one had ever offered that to me before, like none. And I was obviously intoxicated. I've read the FOIA reports on everything, and they're like, I could smell the alcohol on Krista, and but no one had ever offered it. I never knew treatment was an option, and I was like, okay. And I ended up taking that route, and I got sober. I had to go hours away, but it's kind of like he was doing that before this was even a thing, like out of the kindness of his heart. And I had a loving, supportive family behind me, and not everybody has that. And he saw that it was like alcohol induced, and I had a problem, and he sat there and told me, and I took it. And then the place you guys work with, the Charleston Center, my husband's life was saved 11 months ago yesterday there at the Charleston Center. So there's so much hope, and it's really cool seeing it all come together, and we do have to work together. And if you don't know what you don't know, people don't know there's a solution out there. You got to tell them. And like, right. If someone told me maybe my 5th arrest, I might have started my journey a little sooner, but God had a plan. So.
Right. And like you and I connecting, I just happened to see some things that was not going so well in a different county. And I asked you some questions about it, and we were able to connect. And I was like, hey, what can I do to help? Let's talk to some of these sheriffs in this area and try to figure that out. I don't know what county someone was from, but I noticed they posted that we need reentry specialists. One thing just to point out, before January 7th, we have one reentry specialist in Charleston County. We have funded and added a second full-time, and we're going to continue to grow the unit. But we've already doubled Charleston County's unit since January 7th. So, and again, it's all working together, having meetings and figuring out what are small wins that you could have. You know, I had a mom reach out to me. Her son had a fatal overdose over in our county on a very bad street that we know is a problem. So we sent our teams over there to really do some enforcement and try to sit over there. And then one day I was driving back from a meeting over there. So I sent her a picture of the street sign. I said, hey, I'm over here sitting with my blue lights on. No one's going to be dealing drugs over here right now. And she's like, you don't understand the impact that's had. And then our team and her and some of her friends have went over. We passed out Narcan to every house, you know, just trying to cut. And we've seen a drop in overdoses over there. And that's a big thing. But we've got to stop this high level of fentanyl coming in. I mean, you know, fentanyl is in everything. And unfortunately, you know, we still are seeing some of these fatal overdoses.
And, you know, it's an epidemic, and it's something that, you know, that you guys are doing a great job on. You know, I want to talk about the stigma between addiction and law enforcement. You know, addicts are afraid of law enforcement. Alcoholics are afraid of law enforcement. You know, how do we soften that? I mean, addicts are still doing illegal things, you know, and they don't want to get caught. And you know, they see blue lights behind them. They are in fear. You know, how do we transition the stigma from, you know, instead of, you know, being afraid, these are the people that can actually help.
Yeah. And, you know, that's tough. One of the first things we did is we don't use the word addict at the sheriff's office. We just don't. That's a big thing for us. Even when I hear that word, it makes me cringe. But that was very early on. That's talking to someone in peer support, says, hey, you know what? We don't like that word. Why don't we try something different? And I was like, no problem. But again, that goes back to being open and understanding. And I think that's the biggest thing is with stigma. One thing I do want to mention, every single one of our deputies carry Narcan in their car or on their person. We're switching over to carrying it on their person, so they're not going back to the car. And then for every overdose, we have these kits. It's a pencil case, simple, right? You open it, it's got Narcan. So we carry these, and they're left at every overdose scene for follow-up. But the biggest thing is this bridges the gap between an overdose and follow-up. It could be 30 minutes, could be an hour, could be 2 hours. There's Narcan there until we can get a follow-up done. So the biggest thing is flooding the area with that. But I think the more you see the direction, also every one of our new recruits go to the Charleston Center for a tour. They also listen to Nancy Stedman Shipman from Wake Up Carolina story where she lost her son to an overdose, who was a high schooler and had an injury, and that's how it started, through pain medication. So that's a touching story. And my first time I ever heard her story, I was like shocked. It was such a moving experience for me. And I realized there's more to this job than locking people up, right? It's more than writing a ticket to someone. We need to save lives. And once you, like I said earlier, when you see individuals that have been in crisis and going through their worst time, what they don't want to see is another officer at the hospital, right? Or another officer providing a follow-up. That's why we brought in peer support. Someone that's in recovery, someone that's walked that walk, and that we can work with them together. We're not passing them off to peer support. We're hand in hand, taking a step back and letting peer support handle it and providing services as needed. But I'm telling you, peer support has been the biggest change for us and bridging that gap.
Now, with what you're doing, this has to actually, I mean, you're helping decrease the number of overdoses. 40%. Amazing. How about the amount of other crime you're able to focus on because you're not focused so much on the addiction? You know, you get I'm sure you get calls to the same houses, the same locations over and over again where you're wasting time. And time is the most valuable thing, where your officers could be focused on bigger problems. How much time is actually being saved, and how much other crime, like our felonies down, our this and that down? If you could talk a little bit about that.
It's curbing the crime, probably, for sure.
Yeah, and we don't have our first year's worth of numbers at the sheriff's office for crime, so I can't really talk about that. Statistically, it seems like it's down. I'll be able to give you more of a definite answer once our numbers are in at the end of the year, so I don't want to misquote that. But I will say, you know, when someone asked earlier about violent crimes, you know, what are we doing for violent charges? We are working with the judges to look at that. When it's a violent crime, it's different. We're held by certain standards, and there's not really much we can do. But we are looking for that. But you know, so one thing we've seen is we'll see somebody that's getting a public intox charge, where they've also got an assault charge. Well, unfortunately, because of that assault attack to it, we're kind of stuck, and you have to go to jail. However, when you get into the detention center, you're flagged with our new screening tools that you have a substance use disorder, and we start providing services immediately. So just because you have a charge does not mean you're not going to get those services. I went to a presentation a couple of years ago, and the agency had an amazing program, which is like you said earlier. You know, you go to these conferences, you hear what other agencies are doing, you bring it back to your agency, and you implement it, right? But the one thing that I didn't like is they said, but if you have a felony charge or a warrant, we don't provide you any services. I'm like, well, you're missing your most important population. Like, you got to think outside the box of this. Hold that warrant. If it's a shoplifting warrant, you could hold it, right? If it's a murder warrant, probably not. So look at the totality of circumstances and put the individual above charges. You know, that's what's important. I know based on statute. I love that. Yeah, you know, based on statute, some things we're held to, but not everything. You know, a public intox, really. Take them to the sobering center. Let's get them some help. And you're no longer responding to this guy having a public intox charge every single night. You've got him, and that's where you're talking about saving resources. Yeah. You're not constantly responding to the same house for an overdose. Their same house for, you know, EMS going to the same house for an overdose. It's, you know, it's a big thing, and it's sad to see. I know it's very hard. It's a sickness, it's an illness, it's a disease. It's very hard to break that. But I think if we continue this same cycle of providing services, eventually they're going to take a bite at that, and then we can get them into long-term recovery. And that's our biggest. Planting
the seed.
Right. Yeah. You just have to keep, you know, Nancy Shipman always says from Wake Up Carolina, you're throwing bobbers out, and eventually somebody's going to take a bite at it, and then we've got them in the services they need. And you know, just when there's a fatal overdose, which we hate to go to, if we have a fatal overdose, that doesn't mean there's not other individuals that need help and services in that house. We provide that to the whole family. And that, you know, grief groups, that's another part. You know, that could lead down a road of alcohol and then maybe drug dependency or mental health issues. So you have to work with all of it. And I noticed one of the questions is how do you implement this in an area when there's stigma and law enforcement won't listen? Well, you know what? It starts with the leadership. You have to focus and meet with the leadership of the organization. If it's not from the top down, it's not going to work. And that's why I work for Charleston County Sheriff's Office. Our sheriff proved that before he took office, when he was the chief of police, that he believes in recovery, he believes in providing services, he believes in transparency. And that's why I left the job after 17 years to work for him, because I knew we were going to make a difference in Charleston County. And that's the biggest part of it. We're leaving this community better than the way we found it. And that's why I work here. And this is why we do what we do.
So as far as bringing this to the leadership, I mean, you know, it's hard to get into the leadership. What's the best way of going about that? Would it be going to your, you know, local community outreach meeting? Is it sending a letter to legislation? What would be the best way of going about trying to actually bring this to your community?
Have a sit down one-on-one with the leadership. And I'll tell you, it's a little different. When a chief deputy reaches out to another agency and they want to have a meeting, usually it happens, right? We struggle sometimes with other law enforcement agencies having meetings to discuss this. They just don't want to be at the table. And if we're struggling with that, I know the public's going to struggle, right? You got to be open-minded. You got to focus you have to get ahead of that leadership and show them the impact. They need to see it. And that's a big thing for us. You know, I never thought in my career I'd be sitting in this seat having this conversation, right? But I went to a meeting one time. I covered it as a public information officer. The chief at the time wanted me to cover it for social media. And I'm sitting there videoing this thing, and I'm like, oh, I'm just ready to go. It's Saturday. I wish I was off. And I hear this lady tell a story about how her son died from an overdose. And after it's all said and done, I'm driving home. I'm like, what am I doing? I'm upset that I'm here on a Saturday, and this lady lost her son. Like, I got to put things in perspective. What can I do to prevent someone else from having the same feeling that's lost someone? So let's focus on this. And that's really what kind of helped change my mindset on what it is. So I think these very impactful stories and these very impactful meetings, you just have to go in there and show them. You know, we've approached it with data. I mean, who wouldn't want to have 40% reduction in overdoses in their community, right? I've been to some of these conferences and met with some of the chiefs in not Charleston, but in South Carolina, and we've had good conversation. And they're looking at the SIMS program. It's really just sharing information, being transparent, and focusing on it as a disease, and not looking down upon it. It could affect all of us at any time. You just never know. And I think that's the point.
I personally started when I would see any public official or police or anything, like they talk about recovery or addiction, I would send an email or a call. And then I was sitting down next to the chief of police in my area. Then he's bringing me to town hall meetings. And then I'm like, oh, I get a public comment anywhere I go. So I would sign up and I would just give my 3 minutes. And some listen, some don't. But a lot of the times they want to commend you and they want to tell you, wow, what you're doing is great. And like, we kind of know, us on the other side, we kind of know a lot too. And they want to know, you guys want to know, and we got to bridge that gap.
Yep. And it's just working together. That's the biggest thing, is working together as one and trying to fix some of the issues that are going on in the community. And open door, listen, just have a round, I've had some tough conversations in the beginning at tables and had to hear some things that we weren't doing correctly, but we fixed it. And when you fixed it immediately and you see that change, then you get buy-in because they believe you're listening. That's the biggest thing, is just listen. When you go to these meetings, you don't have to be at the head of the table and talk about it all. Listen to what the public has to say, make notes, and start making changes. You'll get buy-in, you build trust and transparency. And that's the biggest thing. You got to have trust of your community.
I talk a lot about the gift of desperation, right? The gift of desperation is what will open people's minds when an alcoholic or someone addicted to drugs, because you don't like the word addict, I won't use it anymore. When someone's addicted, they get to the lowest possible low that opens their mind to the possibility of changing and finding recovery. The same goes with the government. You see enough overdoses, you see enough crime, you see enough things that aren't, and the things that you're doing aren't working. The government can find the gift of desperation, and to find that another program is getting a 40% decrease in overdoses, that's got to take some sort of, people got to open their eyes, and they got to say, okay, these guys are doing it different. How can we do this here? And I think when you get those numbers, as much as data, data means things. And if you see a decrease in felonies, if you see a decrease in violent crimes, which I'm betting that your numbers are going to come back at the end of the year lower, because you have more manpower to focus on other things than just overdoses and the petty crimes that come with addiction. So I think the biggest thing is your transparency with your data. That's going to be the thing that can really change, because the gift of desperation is everywhere. And if it, having somebody's child die and I can help with that, that's amazing.
Yeah, and one thing I will tell you that we are seeing, talking about numbers that I could attest to now, is we are seeing our jail population numbers slowly dropping. And that's a big thing for us. We monitor that every single day. And we are starting to see our overall average jail population drop considerably. We were averaging 1,500. Now we're averaging 12 to 1,300. That's a big drop.
That's enormous. That's huge.
Right. And I can't say this is all based on overdose response. I cannot say all that. But I think it's a totality of circumstances of everything being put together to provide the best services for Charleston County. And I think we're going to continue to see that drop. And, Charleston County, our biggest thing is when we implement this SIMS, we want to get all of Charleston County agencies on board. We have College of Charleston on board. Hey, we have overdoses, help us. We got college kids. So that's worked out. We've got Medical University of South Carolina Public Safety's on board. The Isle of Palms and Sullivan's Island beaches are on board. The biggest thing is these law enforcement officials have to say, there's a problem in our area, let's fix it. Acknowledge you have a problem and start working to fix it and be open to change.
Kind of where we were too.
Right.
Getting sober. Yeah.
Yeah. It's the same. Yeah. Same thing. Like you said, we want to provide as many services as possible as well and help reduce these numbers. Long-term recovery is the key.
See, now nobody wants to call their baby ugly. Nobody wants to say it because they want to say, oh, our community is perfect. We're good here. Everything's fine. Small town America. We're good. And nobody wants to admit that there's even a problem.
They think it's failure.
you know, you see all of these. I'm from Indiana, and
Okay.
you know, we have a lot of farm communities just south of me, and these communities where all of a sudden there's 12 overdoses in the course of a weekend because they're all on drugs and they got a bad package, and there we go, and now, and oh, this was a one-time thing, and we're just going to keep doing what we're doing. No, this is the call to change.
And I've
Well,
seen
Yeah.
the Wake Up Carolina's posts about Bad Bachelor, or like they'll do like big posts, and I'll share and be like, why can't my county do that? And then I've seen the viral posts of the Narcan dispensers, and I was the one commenting, it's the opioid settlement fund. It's not, we're not just giving it away. It's already paid for. And
so, you know, it's funny you say that. So we put out, so those spike alerts, they come from the sheriff's office. That's us sharing information from the coroner's office, from the sheriff's office to Wake Up Carolina and our nonprofits to put out an alert. Let the public know there's a bad batch. We've got a couple fatalities. Let's try to get ahead of this. And then the other parts of that is we're working together on trying to, we put out this information in real time. You can't get these alerts on Friday night and not put it out till Monday. It's too late. We've lost who knows how many people, right? So the biggest thing is putting that information out, being transparent quickly and efficiently.
And I know our county, because I've questioned where's the opioid settlement fund money going, and I know they got something at the coroner's office for like a faster toxology report for these reasons.
So Charleston County has that program, that device, and it's amazing.
Yeah.
It gives us quickly to be able to put that out. All right, this is what's going on. Let's try to figure out what it is.
So let's talk about that for a second. The opioid settlement fund. Every state in America got money from the opioid settlement fund, and then the state has dispersed it to every city in America. So there's lots of money to do something. How much of that opioid settlement fund have you dispersed for new programs?
Every dollar we have received is for programs within Charleston County. So Charleston County gets a large chunk of money, and then we come up with a plan on how we're going to implement it. We have reporting mechanisms in place that we have to report. It's very well regulated, and our biggest thing, one, was getting Narcan out to the public. The one thing that we're using for this year is we're adding that opioid specialist to patrol, so they will be responding to these calls and providing services in real time. So all of those are type of things that we're doing as quickly as possible to provide services.
And as far as actual recovery, I mean, I'm assuming you're seeing people that you're dropping off at treatment centers where they're actually getting into recovery, and you actually follow up on that kind of stuff.
Yes, our team does. Yes, 100%. The problem is when you stop following up, people stop thinking you care. And then, you know, that's the biggest thing. Follow up, a phone call, a text message. You know, sometimes we get blocked. That's fine. We change our number and send another message. Like, you know, you have to continue that approach to providing services. And, you know, the biggest thing I think that gives us validity to our program is we separate the follow-up and community wellness from the enforcement. They don't even share it. Now, the enforcement side will share information with us. We do not share information back, and it's a mutual understanding. Because I don't care if you have a bag of drugs on your table when we get there, right? I need to get this individual into treatment. Y'all figure out what's going on with this. We're not making a charge anyway. Go after the dealer. We're going to focus on getting this individual into help and work through that. And that's, I think, is the biggest thing, because there's no fear of charges. And once that starts getting out words, hey, you know what? I called because Johnny just had an overdose at my house. I didn't get locked up. The police weren't mad with me. They weren't rude. All right, you know what? Let me talk to this person. Let me talk to that person. Let me provide some services. But if we were going to these follow-ups and locking people up, no one's going to call us, right? Like, no one's going to believe us. No one's going to trust us. And we just started at this agency in January. So we had to rebuild the trust in the community of focusing on what is needed. Let's see. So the reentry specialist with the sheriff's office, they are civilian, and they follow up on it. There is a timeline structure built into SIMS. I'd say that was one of the questions. That timeline alerts us when those follow-ups need to be done, so we don't miss anybody. And then we log in and review them and see where where everything's at. We can see the notes. But again, that's trust, because we're sharing that information with a nonprofit that we have a memorandum of agreement with, so we could share that information in real time.
That's amazing. That really is, I'm telling you, this has been really amazing. You know, today we've been talking with Chief Christopher Rozier from Charleston County, and your transparency has been awesome. I wish there were so many more police officers like you in this country. And you know what? I bet you there are. And I bet you there's a lot of people that are fed up with the numbers that you've seen, and they're fed up with the crime, they're fed up with everything, you know, and you are actually here making a difference. I hope everybody everybody's been here, everybody that sees this video, you can share it with your local law enforcement, because you know, Chief Rozier here is making a difference. So,
yeah, and it's inevitable that almost everyone's going to be affected by this. Like, I'm sure, Chief, you've had friends pass away from addiction, or have known somebody has. And then let's not even mention the trauma that you guys go through, the post-traumatic stress that you guys go through on the job. I mean, it all stems from somewhere, and you never know what somebody's going through. And education right here is key. Education's winning, like, just knowing what's going on.
So one thing I wanted to bring to that, we've made it mandatory at the sheriff's office. Every year, every deputy, every civilian goes through a 1-hour mental health check. And what that is, it's a clinician. We partner with Medical University of South Carolina. It's a 1-hour mental health check to make sure our officers are in good standing. And because we do see a lot, we deal with a lot of infant deaths, we deal with traffic fatalities, we're dealing with overdoses. It's really a good way for us to kind of make sure that they're okay. And we have a great EAP program, probably one of the best I've ever seen. That's awesome. A very strong program here that we're continuing. But again, I do know people. I know a lady in a county in South Carolina that can make a real difference in her community, and they keep ignoring it. And her daughter died from an overdose. And I don't know what other impact you could have. Like, I don't know what else we can do to make individuals in leadership positions see that it's a need. I just don't understand sometimes. We get doors shut in our face sometimes. I got plenty, and I just keep right on knocking. Like, I'm here, I'm not leaving. Like, help me out here. Like, what? Dorchester County. So we were fighting hard with another county close to us to get SIMs, and they just weren't doing it. And we were getting frustrated. And then Dorchester County came out of nowhere and got the program and said, hey, will you help us? I was like, heck yeah, we'll help you. We can share information. We can provide services. Because Charleston, Dorchester are so, again, you could live across the street and be in one county or the other. It really has helped us kind of connect those dots on those that are in need. And so the Charleston County has the license for SIMs. Every agency gets to use it for free, and we don't even charge them because we're using settlement funds to pay for it. And it's really inexpensive. Not to mention, if you save one life, it's worth every penny, right? So that's the whole point.
And they go and save other people's lives, because the whole point of recovery is you can't keep it unless you give it away. So we're out here trying to help. It's a trickle effect.
Yeah. One thing that I did learn very early on is when you're in recovery, you're always in recovery. That was not something that really kind of dawned on me until I talked to peer support.
Yeah.
And it's so crazy how you can connect these dots between peer support and law enforcement just by having a coffee or lunch and just sitting down and talking things out. And that's a really good idea. Why don't we do that? We were at a conference and we're like, hey, does our detention deputies carry Narcan on their body? I know we have stations throughout the detention center. And we're like, I don't know. So we made a phone call and we're like, no. So we use settlement funds, and now every deputy will carry Narcan on their person. That few minutes of running to a station and coming back, you don't have to worry about it anymore. It's on your belt. And those first 2 doses may save a life. And, it's just small things that you pick up on that, I didn't know I did that. Maybe that's a good idea. And Horry County, South Carolina has an amazing program in their detention center. And I know their director. So we sent our staff there to learn how they handled overdose response, because they had peer support in the detention center before we did. And we kind of worked through it. They helped us navigate it. Then they sent their staff is going to come here to learn how we're doing with mental health. So it's just working together. Put your ego aside. We're all law enforcement working together. At the end of the day, I go home and take this badge and gun off. I'm a citizen. And we just have to care about people.
So, in closing, if you were talking to another chief of police in another county in another area that doesn't have they don't know what they're going to do with the opioid settlement fund, they don't know how to fix any of the problems. If you're talking to another chief to chief, what is it you say to them to help them open up their mind a little bit?
Listen to your community. Set up a meeting. Set up a meeting with your nonprofits. Set up a meeting with your peer support individuals. Don't sit at the head of the table and don't talk. Just listen and
Oh,
see what they have to say. Make a list and then start checking some stuff off the list. I've been sitting here making lists the whole time. We're on this call, but getting ideas and looking at some
I
of the
love
chat.
it.
I keep looking at the chat stuff to make sure I don't miss any of these questions. But the biggest thing is listening. Listen to your community. You're in that position to serve and protect your community. What are you doing to make tomorrow better than today? And that's the biggest thing. Acknowledge that there's an issue in your community. If you're not tracking your numbers, and how do you know? This program will allow you to track. And again, disclaimer: I don't work anything for Sims. I just believe in it. I believe in the program. I think that's the biggest thing: is listen to your community and see what the problem is. Come up with a plan, and don't be scared to make a change. If what you're doing is not right and it's not working, admit it and change it. You can't do any worse than what you're doing now, and that's the biggest. We took a lot of risk when we kept making these changes. Putting a peer support individual into a detention center, you'll lose a little sleep over that. Scary.
Yeah.
It really is. But to see the positive impacts and closely monitor it, it's worth every bit of it. It really is worth every bit of it. I went over to the detention center a couple weeks ago for a tour, just to catch up on something, and I ran into the peer support lady. She come running up to me, gave me a hug, and they're all like, "You know her?" And she's like, "A couple years ago, I was behind these bars. Now I'm walking these halls as a free woman and helping these people that need help." And
I cried.
it was worth that. You couldn't have done anything. I could have won the lottery. It wasn't worth what happened that minute with her. It was a big deal for me to see how that small gesture of getting them in there has made a difference.
Yeah.
And if we save one life, it's worth every bit of it. But
Amen.
and sorry to go off on a tangent on that, but again,
No, we love this.
very passionate
Talking
about
our language.
Yeah, it's passionate.
So if someone wanted to get a hold of you and wanted to actually talk to you about this, if somebody, because I'm really hoping that people take this video and they go to their, leadership, they go to their elected officials and say, "Hey, this guy's doing it." How would they get a hold of you? What's the best way? Is it email?
Yeah, send me an email and we can set something up. I could do Zoom. I've done Zoom with other agencies before and kind of talked out some issues that they were having and work through it. Our biggest thing is I'm available even after hours. If we need to do a phone call, Zoom, whatever, to get that worked out, we're here to help. And again, we don't always get it right. We don't always do it right the first time, but we listen and we pivot and we make it happen. And that's our biggest thing. And we put the best people in place. But yeah, do you need me to give you the email now? Do you already have it? You want to put it out or?
I think Megan put it out in the comments.
Okay.
But I mean, we are planning an event in January that we're going to have speakers at, and it's going to be fun. And we're going to talk about recovery and everything. And I'm really hoping that you're going to be there. We're going to be in Charleston, so hopefully you'll be able to come and actually share. And it'll be January, so hopefully you'll have some new numbers. And we just got to keep pushing. Keep pushing. If you go and you try to talk to the local chief and they don't have time, keep pushing, because we can all, if we stand together, we can make a change. You're making a change, and we can take what you're using and show it to other people, because I'm telling you, I love it and I'm excited. And I'm meeting with my my town this week, and I'm excited. I'm gonna tell them about your programs. And
this helps even with child protective services, brings families back together, lowers the emergency room rate, lowers the incarceration rate, stops crimes, like you name it. It's literally the trickle effect. And I'm very grateful, Chief, that you listened to my Facebook messages and responded back. And I'm grateful for this connection so much.
Yeah, you posting about a problem in your area is what caught my attention. And that, for a sheriff or chief to say they don't have time to meet with you, I'm sorry, that just doesn't cut it. That's not true. you can make time for what's important. And, you know, I made time for today. It's not a problem. It's important. And it's overall making your quality of life better for your citizens. And that's, you know, that's what's important. One thing about SIMS I wanted to share, because we always get this question, what about HIPAA, right? So law enforcement is making the entries. So it's out of public information, freedom of information records. It's not coming from medical. So we don't have to worry about that. That does put some struggles with the hospitals. You know, we don't respond to all overdoses. Some people go straight to the hospital. So we don't get that data all the time, but we're working on trying to figure that out, what that looks like. And EMS as well. We're working together with them on what that looks like. So just know that we've thought all of those avenues, because you know that question is going to come up. No one's going to question us.
Yeah.
Absolutely. Well, thank you so much for your time today, and this has been tremendous. Thank you all for watching, and you know, bring this to your local government, and let's see if we can all make a change. Chief, thank you so much for everything you're doing, for recognizing this as a disease, and for seeing it as in a different set of eyes, brother. I love you. Thank you so much.
Thank you so much.
Let me know, and as the emails come in, I'll make sure I respond back to them. And anything we could do to help anybody in the community, even if you're not a Charleston County resident, we'll be glad. Bounce an idea off of us. Who knows? I may be able to pick up an idea from someone else and see that something we could change in our system. But we're willing to do whatever.
Yeah, we're gonna have to come over to Beaufort County.
Well,
I'll set it up.
Thank you, and we'll see you all again next week. And Chief, we're probably going to have you on here again. So let
me know when. Thank you.
Calendar open.
All right. Thanks.